So now that we've run through all of the possible acid-base imbalances, let's talk in more detail about the oxygenation levels that you're going to find on an arterial blood gas. First, I just want to do a quick review of gas exchange. Remember that venous blood enters into the capillaries in the lungs deoxygenated, and carbon dioxide comes out into the alveoli, oxygen comes into the blood, the carbon dioxide gets exhaled, and the blood continues into the arteries fully oxygenated. So when we're obtaining arterial blood, this is the process that we are evaluating. Are the patients getting appropriate amounts of oxygen into their blood? So there's two main values that we receive on an arterial blood gas. The first is our PaO2. That stands for partial pressure of oxygen, or remember, the amount of oxygen dissolved in the arterial blood. Again, this tells us how well gas exchange is occurring in our lungs. Are we getting the appropriate amount of oxygen into our arterial blood? Now, the SaO2 tells us how much of our hemoglobin is saturated with oxygen. This is our arterial oxygen saturation. So it's giving us an idea of the capacity of our blood to actually carry the oxygen out to the tissues. Now, in either case, if the levels are too low, you could see things like cyanosis, cold skin, or shortness of breath, or tachypnea as the patient is trying to compensate for that lack of oxygen. So now I just want to go through each of these and give you some critical points about each one. First, let's think about the PaO2. If you remember from the very first lesson, I said the normal PaO2 is 80 to 100 millimeters of mercury. But remember what was special about that? This value is assuming that the patient is on room air, which is 21% oxygen. We write that FiO2, or fraction of inspired oxygen. So if you have a patient who has a PaO2 of 120, you're going to think, holy moly, he's doing great, right? Except this patient is actually on 60% oxygen, 60% FiO2. So in reality, it's not that great. So to really evaluate how well your specific patient is actually doing, we use what's called the PF ratio. Normal PF ratio is greater than 400-ish. So think about it. If you have a normal PaO2 of 90 and that patient is on 21%, and we'll write that 0.21, if we divide that, that gets you about 430. So that's a great oxygenation level. So we divide the PaO2 by the FiO2 to really see how well they're doing. So less than 200 is considered severe respiratory distress, severe acute respiratory distress syndrome. If they are less than 300, they have some sort of lung injury, and it's not a good situation. Now, we do talk about this in detail in the ARDS lesson in the respiratory course, so make sure you check that out. So let's use this example I just gave. 120 divided by 60%, which we would write 0.60. When you divide that out, you get 200. So is this patient really doing that well? Actually, they're not. This is not a good oxygenation situation for this patient. Okay, so it's super important that you're really looking at the big picture and that you understand that this normal value is on room air. Now, what I want you to know about the SaO2 is that there are some things that are going to affect its accuracy or its reliability. So because of these things, you may see a high SpO2 or a high SaO2. So this SaO2 is arterial, SpO2 is peripheral, so that's pulse oximetry. So you may see these high numbers, but then the patient's actually not oxygenating very well at all. So remember, this is about hemoglobin. This measures the saturation of hemoglobin. Each hemoglobin has 4 heme groups, and each of those can hold an oxygen molecule, right? So anything that affects my hemoglobin's ability to hold this oxygen is going to affect this number. So if I have 100 of these and 95 of them are fully saturated, then I'm at 95% saturation. But there's something called the oxyhemoglobin dissociation curve that basically compares the PaO2 to the SaO2. And I'm not going to give you a whole lot of details here, but generally as the PaO2 rises, so does the SaO2. So what happens is there are different conditions like temperature changes or acid-base imbalances that can cause a shift in this curve to the left or to the right. So what that means is that at the exact same SaO2, you may have a much lower PaO2 or a much higher PaO2. So if this is the only number you're looking at, you're not really going to get the whole picture, okay? So another thing that affects SaO2 is anemia. Remember, anything that affects my hemoglobin's ability to carry oxygen is going to affect my SaO2. So instead of having 100, let's say I had 50 hemoglobin molecules. That's anemia, right? I have less. And let's say 48 of those are full and saturated. I'm going to have an SaO2 of 96%. But I know that my actual oxygen carrying capacity is still much less because of that anemia, because I have less blood cells or less hemoglobin working appropriately. So it kind of fakes you out. The other thing that'll fake you out is carbon monoxide poisoning, because carbon monoxide will come in here and take the place of these oxygen molecules. So it will look like it's saturated, but it's actually saturated with the wrong thing. So you really can't actually carry enough oxygen out to the tissues. And then don't forget, of course, if you're looking at peripheral oxygen saturation in your pulse oximetry, then the temperature of the skin, perfusion is also going to affect how reliable that number is, okay? So again, these are some things that you just need to be thinking about critically when it comes to your patient. It doesn't mean that we ignore the oxygen saturation by any means, but make sure that you're really looking at the big picture of what's going on with your patient specifically. And if you feel the need to, grab that extra value. Ask for the blood gas so you can see in more detail what's going on. Now, as far as therapeutic management for any kind of hypoxia or hypoxemia, we always want to treat the underlying cause, administer supplemental oxygen. If anemia is part of the problem, we may also be giving blood transfusions to get that hemoglobin level up. And then if there's any kind of airway or breathing issue, then we may want to provide support or mechanical ventilation. Now, I know that I hammered this home in the respiratory acidosis lesson, but I'm going to say it again. Giving supplemental oxygen to someone who is not breathing correctly or has an airway issue or an airway obstruction is not beneficial, okay? Yes, in the real world, it takes 5 seconds to put oxygen on, but it also only takes 5 seconds to apply an EKG lead, but that's not actually going to help the patient. It's not always about how quickly you can do something, but about the impact it's actually going to have. So make sure that your patient's airway is open and that they are actually breathing first, okay? Okay. All right, let's recap. The PaO2, or the partial pressure of oxygen dissolved in arterial blood, gives us a good picture of the ability of the lungs to perform gas exchange and to get oxygen into the arterial blood. Normal value is 80 to 100 on room air. The SaO2, or the arterial oxygen saturation, tells us how much of the hemoglobin is saturated with oxygen and therefore gives us an idea of our capacity to carry oxygen to our tissues. Again, just remember to look for things like anemia or signs of carbon monoxide poisoning that may indicate that your SaO2 level is not as reliable. Always remember to look at the big picture. The PF ratio will also help you get an idea of how bad the situation is for your specific patient by comparing the PaO2 to the FiO2. And of course, we always want to treat the cause first. Make sure they have an airway or breathing support, give supplemental oxygen, give a blood transfusion if anemia is the problem. Just make sure that you're addressing the actual cause of the problem. Okay, so those are the basics of evaluating the oxygenation values on an arterial blood gas. I have attached the ARDS case study to this lesson as well so that you can practice calculating those PF ratios. Make sure you check out all of the other resources attached to this lesson as well. Now go out and be your best selves today, guys. And as always, happy nursing.